Harper was 14 days old when we found out she had cystic fibrosis. She tested positive on the newborn screening, and when we went in for our appointment, they told us. A million things ran through my mind. I had no idea what her life expectancy would be, what it meant for us on a daily basis. I just looked at my baby, who appeared totally perfect, and thought, I couldn't imagine not having her. We were told that we needed to come down to Vancouver to go to the BC Children's Hospital. There we were going to see a team of specialists that unfortunately Kamloops was unable to offer locally for us. Currently, there is no cure for cystic fibrosis. We know they're working on it. They're getting closer, but there's no cure.
In the past, here in Kamloops, we used to have a lot of pediatric patients that were in the hospital. But over time, the medications, the pharmacology has progressed so much that the patients are managed at home. And if they become severe, then they're transferred down to the coast. Our students here at Thompson Rivers University, they miss out then because they don't have that opportunity to see those acutely ill or even chronically ill children. So we have to fill that gap somehow. Because we don't have access to real-life pediatric patients, we've been training our nursing students using mannequins. The medium and the high fidelity mannequins come the closest to being like a live patient. So we can listen to chest sounds, we can listen to bowel sounds. A lot of them can talk, a lot of them have cameras in their eyes. You can put an IV into them, you can run medications through them. So there's a lot of checks and balances that we can use with these mannequins.
One of the main benefits of what these mannequins can do for us as students is they can simulate experiences that we don't have the opportunity to see in our clinical practice. It gives us the opportunity to hear all sorts of adventitious lung sounds, wheezes, crackles. You know, it really prepares you for when you're in practice and you need to be able to identify those sounds in order to help the patients.
Unfortunately, we don't currently have a child or an infant high-fidelity mannequin here at the university. This is something we're really hoping to work towards for our students because adults and children behave quite differently when they are ill. And it's important for them to know those differences in order to detect changes that will save lives. Once these students graduate, we want them to be able to take the skills that they have learned by using these mannequins into the real world so that potentially they could maybe help a child like Harper.
Our hope for Harper is that she will live as normal a life as possible. She loves to dance. She loves to play sports. We just try to make every day count. It's just about savoring all those simple little moments that are our life.